Dr. Collier, good morning.
Good morning, Rickey, Smiley, and thank you once again for the opportunity to bring healthcare information to the listeners of
answer
the Rickey
your phone,
Smiley
Dr. Collier.
Morning Show.
Answer your phone, Dr. Collier.
Get it, Brett.
Dr. Collier, answer your phone, Dr. Collier.
Dr. Collier, Dr. Collier.
Yes.
Dr. Collier. Brett,
Yes, sir.
Brett had to sit on my back this morning, and you found a knot in my back.
Yeah, he had a knot in his back. He was real tense and couldn't hardly move, walking around here like an 80-year-old man.
What is that, Dr. Collier?
Probably be a sebaceous cyst. It could be a lipoma as well. We'd be happy to take a look at it, Rickey.
A what?
You know, we remove those in the office, not a problem.
Why couldn't just be a tight muscle?
It could be that as well.
He said a what?
He was walking around like an old man, and it could be muscle. I think Rickey complained of some muscle spasms in his back after sleeping on the couch. So it could be that as well. But it could be a big cancer lump, and you could be gone in 6 months.
Damn, Dr. Collier.
Just got dark. I was just telling y'all what it got dark.
Dang.
I thought it was gas, but
I'd rather gas or a muscle cramp than a...
Everything ain't gas, Gary.
Everything ain't gas, Gary. So, Rick, our topic today is cancer prevention, and the question is, does vitamin D prevent cancer or lower the risk of dying from cancer? So when it comes to the effects of vitamin D on cancer, all scientists do agree that vitamin D is generally not low vitamin D or vitamin D deficiency is generally not a good thing. Adequate levels of vitamin D are important, and according to laboratory studies, vitamin D deficiency seems to help certain cancers develop. Studies found that people living in southern states where sunlight exposure is high were less likely to develop or die from certain cancers than those living in the north. Because exposure to sunlight leads to higher productions of vitamin D, it was thought then, okay, let's look and see if variations in vitamin D levels might account for the cancer variations that we see. So high levels of vitamin D have consistently been associated with reduced risk of colorectal cancer and bladder cancers. And studies have shown that lower vitamin D levels are associated with higher overall cancer mortality. So people with low vitamin D get higher levels of cancer and die from cancer more often. So there was an analysis of 4,000 cases, Rickey. That included prostate cancer, lung cancer, colorectal cancer, and ovarian cancer. And they found that there was a 17% lower cancer mortality among men and women and those with higher vitamin D levels, and that those with low vitamin D levels had poor prognoses. So this is also the fact that cancer therapists and cancer itself have a tendency to lower bone mass and cause osteoporosis. So maintaining good vitamin D levels are good. So how do you know you have a vitamin D deficiency? How do you get vitamin D naturally? People always ask me that question. Unfortunately, Rickey, very few foods commonly consumed in our diets contain vitamin D naturally. There are things like breakfast cereals, amazingly enough, and milk that have vitamin D supplements in there, and they can help. But as we age, our skin becomes less efficient at making vitamin D from sunlight. So most people that I'm testing in my practice, I would say 8 or 9 out of 10 have vitamin D deficiencies. So what do you need to do? You need to take vitamin D supplements at a therapeutic dose. The recommendation has traditionally been 5,000
international units of vitamin D every single day for the rest of your life if you're over the age of 25. Am I right or wrong, Dr. Collier?
You are absolutely correct, sir. So we need to get these cancer rates down and see it can help you treat and makes cancer therapies work better. So if you are diagnosed with cancer, one of the first things they will do is put you on vitamin D because it makes virtually every type of cancer therapy work more efficiently. So vitamin D is a very simple and elegant way, if you keep those levels up, that reduce your risk of getting those cancers that we listed. So, Ricky, let's go to the callers and see if we have any questions.
And if anybody wants 5,000 international units of vitamin D every day, go to lipodrops.com. That's Dr. Collier's own vitamin. I take them every single morning. About to take mine now. Lipodrops.com. Let's go to the phones. Good morning.
I'm calling to find out. I have gastritis, and I'm trying to find out what is the best thing to take. Omeprazole, and that crap is not working. What else can I take? Something natural or what have you?
Okay, ginger is very good for gastritis, but probiotics are the answer to your problem. Probiotics will change the gut flora and change the way your body digests food and decrease the amount of acid. So I would still take the omeprazole. Omeprazole is very good. You can also supplement and add an H2 blocker like Pepcid AC or famotidine. The over-the-counter dose is 20 milligrams. The prescription dose is 40 milligrams. You can get the over-the-counter and just double it up, and that will complement that. But probiotics, go to the website, lipodrops.com, and get some lipobiotics. That will be life-changing for you.
All right, you're on with Dr. Collier. Good morning.
My name is Lacey, and I'm calling from Spartanburg, South Carolina. I'm calling because I feel like I have heart palpitations, and I've had a Holter monitor on for the 48-hour period, but at the same time, during that time, none of the palpitations would come, and I just want to know what I should do from there.
You can have monitoring for a longer period of time, but oftentimes you feel as if you're having palpitations, and it's not pathological, meaning your heart resets just like a computer needs to be reset, and it just changes. When it's in a normal rhythm, your mind blocks it out, and you're totally unaware of your heartbeat. But if the rhythm changes, it gets your attention, and sometimes it can be a little disorienting. But most of the time, palpitations are not a problem. If you've had a 48-hour Holter monitor, chances are that it's not a real problem for you, and you just have to appreciate the fact that it's not your heart. It just feels that way. But right. You can also be monitored for 2 weeks, up to 2 weeks, and see if that makes a difference.
All right, John, Dr. Collier, good morning.
Hello, my name is Brandon Black, and I'm from Pompano Beach, Florida. And I wanted to ask the doctor about every now and again I have a sharp pain on the side where my heart is, and it'll scare the heck out of me. So I was wondering, like, what that means, like, because every now and again I'll be fine. For every once in a blue moon, I'll have a sharp pain, like I'm about to have a stroke or something, and the side where my heart is at. So I wanted to know, like, what that means or what I can do. I went to my doctor for it, and she couldn't, like, even give me an answer. Like, she wasn't sure.
Oh, you need an EKG to evaluate and make sure that you don't have a heart problem. That would be the first step. Also, simple things like making sure your blood pressure is not elevated. But once you've ruled out that it is heart, most people think that it's their heart. But if you take your hand and stick your thumb up and your hand flat and you stick that under your left breast, that is actually where your stomach is. Your heart is directly behind the breastbone. So oftentimes it's a GI problem, meaning you're having like some acid reflux or something, and that would be it. But you don't have a heart attack over an extended period of time. So the chances are that's not it. But if you have not had an EKG, I would definitely get one just to make sure that they rule out a heart problem or a heart issue.
All right, John, Dr. Collier, good morning.
Hi, I was calling to see, I have arthritis in my knee, and they told me I have a torn meniscus. What can I do to prevent that? Because I don't want no surgeries. I get anxiety when I hear about surgeries and everything. I want to know what is I can do to prevent this pain, because I'm having bad pain in my knee.
Okay, well, torn meniscus.
Her knees? She said her knees?
Yeah. She said her knee. She's got a torn meniscus. And so that's already something you can't prevent. Now you just need to heal from it. And the primary therapy is an anti-inflammatory and physical therapy, and it can heal over time without any surgery. But you can also get plasma-rich platelets injected. These are the stem cells that can allow that to repair itself quicker, but the primary therapy is physical therapy and an anti-inflammatory. That would be Motrin, Naproxen, Advil, Aleve, Celebrex, or Mobic, Meloxicam. Those would be the choices that you would do, and then it's just going to take time. Also, if you're overweight, you need to lose some weight. That will help as well.
Dr. Collier.
Yes, sir.
Before you go, remember next month, two big things that we have to start talking about more.
What's that?
These nuts.
Sorry, Dr. Collier.
These are the opinions of Dr. M.J. Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast for us production crew. And one more thing, Ricky. 16, don't you dare go away. You're listening to Dr. MJ on the Rickey Smiley Morning Show.
Dr. Collier.
Yes, sir.
Dr. Collier, hey, we said you leaned in on that one. We said we got two big things. You leaned in. Dr. Collier, when you leaned in, your mouth was wide open. You said, huh?
It was wide over.
You said, huh? We said, he's nuts.